Hi everyone, just a quick heads up. Today's researcher studies socioeconomic indicators related to suicide. So this topic might not be for everyone.
Ahem. This podcast is brought to you by the AlmaMAC and Scientific Canada. It was recorded on the traditional territories shared between the Haudenosaunee and Anishinaabe nations. Enjoy. I feel like I just butchered that again, even though
That's close enough.
we just had the conversation. Okay.
My research on light adaptation in the fish right now.
I'm sitting in a kiddie pool, actually. It's quite nice,
Oh, that would be great.
but it's
man.
not very professional, as they say.
What's going on, everybody? Thanks for tuning back to the AlmaMAC here on 93.3 CFMU. Here on the AlmaMAC, we interview McMaster graduate students about their research and what they enjoy doing inside and outside of the lab. So thank you for tuning in every Thursday, 12 to 12:30. So on today's episode, we welcome Dr. Chungah Kim, who recently was a sixth-year PhD candidate in the Department of Health Policy under the Faculty of Health Sciences, but she recently successfully defended about a week ago. Was that right?
Yes.
And congratulations once again on such a terrific milestone.
Thank you so much.
So I know you recently defended, and maybe you put that past behind you, but we're going to relive it on today's episode, just talking briefly about your research. So Dr. Kim, can you tell us a little bit more about what your PhD focus was on?
So my dissertation deals with the socioeconomic inequality of suicide and the impact of social policies and welfare generosities on this relationship between socioeconomic positions and suicidal behavior. So the idea basically started that even though the inequality of suicide is a pretty universal phenomenon in many contexts, I think that it wasn't enough addressed in the relevant literature, especially in psychiatric epidemiology or even sociology. Although there are so many empirical studies about the association between the socioeconomic status and suicide, no further questions just beyond the extent of the association was addressed. So I wanted to deal with what kind of questions can be further asked. And also, I believe that because it's a socioeconomic inequality, it's basically the association between socioeconomic positions in society. So, social policy is basically designed to deal with the socioeconomic diversity of people. So I believe that the roles of social policy can be an exogenous change in individual socioeconomic status. So I thought that in establishing the causal relationship between socioeconomic positions and suicide at individual levels, social policy can be a very important factor that helps to establish this causal relationship. So that's why I focused on the social policy.
Mm-hmm.
So
almost like an intervention or treatment.
Yes.
Okay.
Correct. Yeah.
And Dr. Kim, if we can take a step back, so can you describe a little bit about the association between socioeconomic inequity and suicide mortality? What is that relationship?
So my first study actually addressed this part. So I collected all the literature that took cohort studies and case control studies, like general longitudinal designs, and what kind of socioeconomic positions were introduced and what the direction of the associations were. And then I found that education, employment status, income, occupation, and other other variables showing the extreme poverty, such as food insufficiency, home eviction, something like that, and lower income and low level of education and lower social class, which are based on the UK like a categorization, were associated with higher risks of suicidal behavior, including death attempts and ideation. So as far as I know, there was only one context that showed the reverse association, which was in Italy. And except that, I think there are more than 30 countries at least in the study, and all the countries showed the positive association between the lower socioeconomic positions and higher suicidal risk.
Okay.
Does it have? Yeah.
Interesting. Do we know why Italy was the outlier in this case?
Yeah, but there is only one study, so I can't say it's generalizable, and also there are so many limitations in data, so not sure, but that was the only case showing the opposite association.
Interesting. And can you also, so once you establish this, and you looked at different studies from a variety of countries, and you looked at this association, what was the next step after this initial question was answered?
So the first study was in the systematic review to confirm the association and the extent of the association. That was what previous studies have been done. So I wanted to be beyond this question. So what I tried to say is that there were like I found one systematic review summarizing the association, the extent of the association in high-income countries. I mean, it didn't intend to include only high-income countries, but the previous review actually studies with the cohort study and case control studies. So regardless of their intention, there were only high-income countries. And it was kind of outdated. It was done in like 12 years ago.
Okay.
But there were only certain contexts. So and also there were like strict inclusion criteria. So lots of important studies were actually not included in the systematic review. And it's a systematic review, so the study designs or the heterogeneity of different designs cannot be really included. So what I try to do is to include this heterogeneous design, and I want you to find different research topics from the studies dealing with the association between socioeconomic conditions and suicide. Still, there are more specific questions from each study, right? So, for example, one study tried to see how the socioeconomic inequalities have changed for the long-term period, like for the last 40 years. Or other studies looked at the trend of socioeconomic inequalities during the economic boom or economic recession, something like that. So there are more specific questions. They are not just they don't just want to look at the simple association, right? So I just want you to find what kind of topics are introduced from each study, and I wanted to categorize them and suggest what can be done later in the first study. Yeah, that was the first next step after looking at the simple association, and then my focus moved to the social policy and its role on these inequality issues. That's my specific topic in this area.
Yeah. And do you want to speak to that a little bit? This focus on social policy.
About the social policy. Yeah. Okay. So Yeah, there are two empirical studies in the dissertation. The first one is to look at the aggregated welfare generosity rather than looking at individual programs. So these days, more and more intervention studies are being conducted, right? Because of the development of the method in quasi-experimental studies and natural experimental studies. But before I jump into that, I wanted to see the general level of welfare generosity. It can be, an individual looking at the effectiveness of program matters, but welfare states one made at once, and it's accumulated and it's been made for a long time. So I think that looking at all the aggregated general level of welfare generosity is very important. That's why I first looked at the welfare generosity, and I found that the Canadian provinces can be a good case study example, because first it's federal country, so each province has political autonomy. So there is a significant and considerable variations in terms of general level of welfare generosity for provinces. And so the level of suicide mortality and the level of socioeconomic inequalities in society also are different across the provinces. So it gives a nice opportunity to look at the provincial welfare generosity on society mortality and inequality. Yeah. So I confirmed that actually I couldn't find the main effect of the welfare generosity, but I wanted to look at the differential effects of the welfare generosity on people who have different socioeconomic positions. So I actually focused on the employment status.
Okay.
So no main effect, and also no welfare generosity wasn't no association. No welfare generosity have had an association with the employed, but the association was confirmed among those unemployed and those not in the labor force.
Okay.
That's the results of the second study. And the third study, deals with the evaluation of the individual studies. So I am from South Korea, and there were recent big reforms in terms of pensions for older populations.
Okay.
So because Korea has rapidly developed, we didn't have wealth until 1990s. So before 1990s, there was no pension system. There was, but it only covers for just a certain population, like civil servants and the public sector workers, which only, I guess, less than 20% of the working populations. And then, people had to prepare for their retirement by themselves until 1989. So you can imagine, like, all the populations are not ready for saving money for their retire period. So historically and still nowadays, elderly poverty rate is extremely high in the country. It's about 50%. 50% of the older populations are under poverty line, which is highest in high income countries. So there was no confirmed causal relationship, but many people believe that the prevalent poverty can be an important reason for explaining high suicide rates among the older population. So yeah, actually suicide rates among older populations are really high too. So it depends on the age groups, even among the older adults. So like those aged 85 or over, the suicide rate is over 200 per 100,000 people, which is the level that can be compared to Canadian Aboriginal population. So it's really high. So people recognize the problem and people try to connect it to the prevalent poverty problem. But there was no, as far as I know, there was no study looking at these recent reforms to suicide.
Right.
So I jumped into this area and I found that there were two reforms basically. So the first reform is to extend the covered population. So before this reform, I really need to explain very detailed information about this pension program because it's complex, but I just want to say the essence. Before this reform, we had a non-contribution based pension, which is a pension that people don't need to pay for their pension, but for certain population who are under low threshold are given a certain amount of money from country, and then the money is based on the tax revenue. That's the gist of the system. And before the first reform, only 15% to 20% of the populations were covered by this previous form of the pension. But the government implemented the first reform to extend the covered population from 15% to 70% in 2008 and 9. And then in 2014, the second reform was implemented to double the benefit. So the benefit level in 2008 was about 87 American dollars, which was only 5% of the national pension premium, which was pretty low to cover the poverty.
Right.
But it was doubled in 2014. Now it's about 160 American dollars, which is about 200 Canadian dollars. It's not enough, but it's not negligible, I would say. So my study showed that the first reform was not followed by the reductions in suicide mortality among the low-income older populations. I mean, it's hard to draw a conclusion because there were significant time-bearing compounder, which was 2008 to 2009 recession. So I could see, like compared to the control groups, there was less increase in suicide, but it's hard to the policy because my control group was a working population. I mean, it's similar to their age, but they are still working population, so they are more likely to be affected by this recession. So it was impossible to tear apart the influence of the recession in the first reform, but the second reform showed that increase in the benefits led to reductions in societal mortality among the adults, especially among women. Yeah, that was the result.
Okay, so I know you mentioned that the fact of the confounder that 2008-2009 economic recession may have impacted the results. But the fact that the second policy, the one where they doubled the pension, and you found that it led to a reduction of suicide mortality, particularly in women. What do you think are the implications of that? And I wonder if, so this was in South Korea, but I also wonder if similar social policies are applied elsewhere. What do you think are the implications of this?
So even though previous studies were not published, I found some kind of manuscripts and reports done in the US and Canada. It's also, Canada has old age income security programs, right? There was previously called the old age allowance. And then in the US, there was a similar program. And Canada's old age allowance is a universal program. And it was introduced in the 1950s. And then actually, even in Canada and US, these programs were followed by reductions in suicide mortality. So I think it's pretty, generalizable to the context. And back then, I'm sure that the poverty rate among older populations are quite high compared to these days. These days, like most high-income countries, or older populations' poverty rates are quite low. But thanks to this kind of policies and the introduction of old age income security programs, the poverty rate in the populations were really low thanks to this social policy. So yeah, there are, even though it's not published still, these studies actually didn't find any impact in other mortality. It was only suicide and alcohol-related mortality. So it's obvious that suicide is more sensitive to this with these reforms in increasing people's income and especially eliminating the poverty. So yeah, I think that in certain populations in Canada, especially among the Aboriginal populations, suicide rates is significantly higher. And I know that there has been some observational studies or the qualitative studies that poverty can be an important causal factor, but still people don't believe that it's a causal factor. So I think more and more programs and more experimental studies should be done in the populations, and also for those populations with the higher poverty rates, we need to look at the potential of the socio-economic programs to increase their income and to motivate their activity in labor market.
That was actually going to be my next follow-up question. So you mentioned that these these policies, they were the most sensitive to suicide mortality and they didn't have any impact on other types of mortality. But I also wonder if things like an unconditional basic income or poverty reduction strategies, I feel like I've read some papers that have suggested that these have tremendous impact on mental health and, securing housing, eating healthy food. So I wonder about the impacts beyond just suicide mortality.
Mortality is a distal outcome. So most of the mortality, for studying most of the mortality, we need a long-term follow-up, right? But it's not suicide and acute death. So it's obvious that why suicide, it was easy to detect the impact of the programs on suicide. It doesn't mean that suicide is only the outcome that shows, suicide is the only outcome that is affected by this these programs. For sure, it's not just suicide. These policies are designed to deal with the socioeconomic output first. That was the first, right? So, as far as I know, lots of social programs, including basic income and giving the lower household children opportunity to move to better neighborhood. These experiments, as far as I know, are known to have impact on their social mobility. And social mobility in general are associated with the positive health outcomes for sure. Yeah. But to me, it's quite surprising. Even Canadian suicide prevention national strategy, there's no specific strategy how to deal with the socioeconomic inequalities in societal mortality. Interestingly, it was the same in the US, but in the US, it's changed several years ago. Since in the late 2010, there was a surge of suicides in the lower educated population. So in 2014 to 2017, there was a far decrease of the life expectancy in overall population.
Oh.
And economists found that deaths from suicide, drug overdose, and alcohol accounted for this decrease in overall life expectancy. So people started to look at this phenomenon, and it's important to deal with the socioeconomic diversity of those people who are unemployed and low educated in the rural areas. So they started to be interested in this issue, and the American CDC uploaded the National Strategy Prevention Framework, and they prioritized strengthen economic support among all the possible policy options.
Okay, well, thank you for sharing that, Dr. Kim. And just the few minutes that we have left here, I did want to, learn more about you and touch base what you enjoy doing outside of the lab, and maybe some of the hobbies, even if they're hobbies that you picked up during this pandemic. What is it that keeps you going?
I love cooking, exercise, and drinking beer. So, because of the pandemic, I can't go to the gym. So I haven't lifting weights for the last 1 year, which is so sad. I'd like to go back to the gym as soon as possible. And in terms of cooking, my cooking skill has been improved a lot during the pandemic, since we can't go to the restaurant. And as I said earlier, I am from South Korea, and I couldn't find a good Korean restaurant in Hamilton area. So my parents sent me some the authentic ingredients to.
Nice.
Yeah. So I've been cooking a lot of stuff, and I've been trying different dishes, not just Korean food. And cooking is one way to release stress from studying. So I'd like to recommend cooking for those who can't find a good hobby. And beer, I like to craft beer. I didn't know the taste much back in Korea, but ever since I came to Canada, there are lots of great breweries near the Hamilton area and GTA area. So I got to know the taste of sour beer and different taste of beer. So these days I'm like on weekends, whenever I have time, I like to visit. I've been visiting these breweries to taste different types of beer, and I would like to make my own later. Like once I have time, I'd like to learn the skill to brew beer, and then I'd like to even open my own brewery, like after being retired from the research work. Yeah, that's my plan.
I like that you're waiting until after retirement, maybe as like a little present to yourself. But thank you very much for coming on the show today, Dr. Kim. It was wonderful to learn about your research and the truly important work that you're doing. So thank you for that.
Thank you for having me today.
And thank you to all of you who are listening here on 93.3 CFMU or wherever you're finding this podcast. Thanks for tuning in. We'll be back next week. Take care, everyone.